I'm Professor Dr. S. Natarajan from Mumbai, India. And unfortunately, India is facing mucormycosis as a problem after during the COVID second wave. We are all in lockdown. Many states in India are in lockdown, and it actually affects the diabetic people who are treated with COVID, with corticosteroids, or treated with immunomodulators like tocilizumab or itolizumab, or also treated with mechanical ventilation and long-standing oxygen therapy. And I also heard from my other ophthalmic colleagues that people who are not diabetic but post-COVID they became diabetic, and those people, or some of them, are also getting it. So I think the initial symptoms could be facial swelling, facial skin discoloration, ptosis, proptosis, restricted eye movements, palatal discoloration, palatal necrosis, and brownish discharge from nose, or sometimes blood discharge from the nose, sinus headache, facial pain, stuffy nose, bloody nasal discharge, blurring of vision, double vision, dental pain, and loosening of teeth. And the main thing is, I think it can affect any of this. So many times they either land up with an ophthalmologist or an ENT specialist or a dental, and some rarely, I think also, if they don't pick up at the stage from the sinus, it goes to the eye, and eye to the brain, and that can be really fatal. So usually we ask for a complete blood count, blood sugar levels, renal function tests like the serum creatinine, blood urea nitrogen, deep nasal swab for KOH staining, nasal endoscopy biopsy, MRI for extent involved, CT scan for the PNS to determine extent of involvement. And I learned from my ENT colleagues, MRI with contrast is important because this particular mucormycosis is actually affects through the blood vessel and actually produces tissue necrosis, which may not be picked up by CT scan. That's why it may not be picked up by just ordinary MRI, maybe with a contrast. So the reason is if for an ENT surgeon, MRI with a contrast is important. For example, sinus is involved. They have to scoop out all the necrotic tissue, and then only you can treat the patient totally and eradicate mucormycosis. And actually, mucormycosis is ubiquitous. It's seen in nasal mucosa and some. It's there in air. It's in moist areas. So the problem is it's there, but only when you're immunocompromised or when immunity goes down, I think the mucormycosis gets manifested. Fortunately, mucormycosis is not contagious. So from one person to another, it won't go. But if you're a diabetic, the mucormycosis or any fungus enjoys the nutrition of sugar in the blood, which actually will produce. It'll thrive and grow more in the high blood sugar levels, and also if you have the like a contaminated mask, or when you're using oxygen where you were using a contaminated tube, if the immunocompromised, I think the patient can get infected. So the main thing will be, it is a team approach. An ENT doctor, an ophthalmologist, and also a neurological person should do. The medical management will be strict diabetes control, antifungals like amphotericin B, and post-canonical loading dose, and with a follow-up for 4 to 6 weeks. And main thing will be the early surgical debridement. I also heard from ENT surgeons that once it involves sinus, and if it's active, and if you don't do surgical debridement, there's a possibility it will spread fast, and then the starting treatment is also expensive, and then it can spread to the brain, and it can finally patients may die. The problem with the coronavirus, the COVID, is also attacks the blood vessel. It produces retinal vein occlusion, branch vein occlusion, as well as coronary artery occlusion. And here, mucormycosis adds to that by going through the blood vessels and eroding into the tissues and getting infected. So main thing will be to maintain hygiene. One is good hygiene. Continue the same. My suggestion is how to prevent mucormycosis. Well, it's called the black fungus by the lay public. It is unfortunately there are thousands of patients in India, and our own Maharashtra state, where I'm practicing in Mumbai, is having about 4,000 patients with mucormycosis. There's a shortage of amphotericin B. So we had to probably the main thing is to prevent. So the prevention starts from preventing the coronavirus itself. That means if you're having comorbidities, if you don't have to go out of the house, please don't go out. Don't go to crowded areas. If you have to go, and maintain wearing N95 mask. And if you're out and there are people wear double mask, then also make sure you sanitize your hands, and you also follow physical distancing. And that's how we can prevent corona. And if you're a diabetic, make sure you have uniform control of diabetes, eat well, eat healthy food, as well as sleep well, so that you can improve your immunity and also be happy always. People are stressed with the corona. Some relatives having mucormycosis, somebody with the diabetes already getting worried. So worry reduces their immunity. So that is why I think you should avoid getting infected with coronavirus or mucormycosis, and watch out for symptoms. And it is also understandable by the patient that if they have some symptom, if they are doubtful, and I think we can do a video consultation if they're not able to go to the clinic. But if there's a doubt by the medical doctor who's doing video consultation, you should get a thorough examination to rule out mucormycosis, because you should not miss the diagnosis, which is very important in the early stage. The dose is control hyperglycemia, monitor blood sugar level post-COVID discharge, and also in diabetics, and use steroid judiciously. Correct timing, correct dose and duration, which has to be left to the physician or the internist. Use clean, sterile water for humidifiers during oxygen therapy. Use antibiotics, antifungals judiciously. Another problem is if you use antibiotics, the fungus can go. And the don't is do not miss the warning signs and symptoms, and do not consider all the cases with blocked nose as cases of bacterial sinusitis, particularly in the context of immunosuppression and or COVID-19 patients on immunomodulators. And do not hesitate to seek aggressive investigations as appropriate KOH staining, microscopy, culture, and MALDI-TOF for detecting fungal etiology. And do not lose crucial time to initiate treatment. I think that will be the take-home lesson. Do not lose crucial time to initiate treatment for mucormycosis. And so I already told how to prevent, and what are the predisposing factors, and what are the symptoms which you have to suspect COVID, and also when to suspect, and how to manage is again leave it to the physician. But I think when you have a symptom or any patient has a symptom, guide the patient accordingly. So team approach works the best. You need a microbiologist, internal medicine specialist, intensivist, neurologist, ENT specialist, ophthalmologist, dentist, surgeon, maxillofacial plastic, and also biochemist. And detailed management guidelines and information available on many places in the internet in both India and abroad. And advisory developed by the following experts of the National Task Force for COVID-19 also is published by ICMR, and also from the Department of Health Research, Ministry of Health and Family Welfare. So I think the what should be alerted by the ophthalmologist, and what are the signs they should look for to understand if the patient is affected. I mentioned, and what should ophthalmologist do if they detect case of mucormycosis in terms of treatment, but also protection of themselves. So if a eye doctor is also diabetic and a comorbid, you take all precaution. And another thing I learned from my oculoplastic surgeon, he says these patients have comorbidity, and because of coronavirus, it affects coronary arteries, and plus it may produce stroke, or in fact, in the myocardial infarction, and you can have a cardiac arrest. So better to do a multidisciplinary approach in a multidisciplinary hospital, so that if you're treating in an exclusive eye hospital, you may land up in trouble both for yourself as a treating doctor and the patient. So for safety, better to take him in a multi-center hospital. So patient should be the first to be kept in mind. So prevention, as I mentioned, one is be happy, be bold, take medical advice, take medical suggestions and treatment, and also and make sure don't be having fear. And fear psychosis will reduce their immunity. And the and since the things are very rampant in India, but I still want to say, even though one good thing is all diabetics are not affected. Their diabetics with a low immunity are only getting affected. And again, even with low immunity, everybody is not getting affected. So it's again virulence of the mucor, which is there. And there's also now aspergillosis, which is affecting the lungs, as well as Candida albicans also is affecting. So my take-home message is that in case you have symptoms, as I mentioned, and maybe I will read the symptoms as the last part is patients who are having diabetes treated for COVID-19 with corticosteroids, treated with immunomodulators, tocilizumab, itolizumab, treated with mechanical ventilation or long-standing oxygen therapy, should be aware that you may get infected. That's the reason you have to be extra cautious and take precautions, and don't be afraid. Be strong and take medical advice. And then, in case you develop facial swelling, facial skin discoloration, ptosis, the drooping of eyelids, proptosis, the eye protruding out, restrict eye movements when you look here and there, and then a palatal discoloration and palatal necrosis or brownish discharge from nose, or a sinus headache, facial pain, stuffy nose, bloody nasal discharge, blurring of vision, double vision, dental pain, loosening of teeth. Please approach the doctor. Even though you're approaching the general doctor in the beginning, immediately contact the concerned specialist and start doubting, and then remove the fear by getting confirmed. But if you have a sinusitis which is not related to mucormycosis, the doctor can advise and you can take appropriate treatment. And in case you need any questions to be asked, you can always contact me by email. My email ID is prof.drsn@gmail.com. prof.drsn@gmail.com. Thank you very much.